National Rehab is a proud supporter of the EB community. We are a leading provider of wound care products and have a dedicated EB advocate team that strives to meet the needs of EB patients. The team will assist with product selection and insurance guideline education. NR supports the EB community by offering the nationally respected EB Nurse website, www.ebnurse.org, and the informative newsletter titled The EB Advocate. We also support several organizations that provide resources to people living with EB and their families. Supporting the EB community is something our entire company stands behind. We are all partners in the care of people living with EB.
EB stands for epidermolysis bullosa.
EB is a rare genetic disorder that results in the fragility of the skin and, in some cases, internal organs.
The skin of a person who has EB is often compared to that of a butterfly's wings. It is that fragile.
Epidermolysis refers to the breakdown of skin. Bullosa means resembling or characterized by blisters.
A person who has EB, the layers of skin and tissue fail to properly adhere to one another.
Blisters and erosions form on the skin and even the internal organs, caused by friction, rubbing, or even the slightest touch.
There is no cure for EB.
EB is most identified by these common symptoms: blisters on the skin, blisters on internal membranes such as respiratory tracts or digestive tracts, and the absence or thickening of toenails or fingernails.
EB is not contagious.
Most people with EB have inherited it from their parents.
EB is caused by the abnormal formation or absence of proteins in the body. More than 10 genes are known to affect the formation of proteins in the skin.
The National Institute of Health estimates that 1 out of every 50,000 live births in the United States have some type of EB.
EB affects all racial and ethnic groups. It affects males and females equally. One child in a family may inherit EB and a sibling may not.
Standard EB treatments focus on the care and prevention of blisters and the treatment of infections in existing wounds by applying advanced wound care products.
There are 3 major types of EB. They are defined by the location of the blister in the skin: EB simplex, junctional EB, and dystrophic EB. All types can vary in severity.
Whether a mild or severe form of EB, receiving good wound care is important. The goal of good wound care is to promote healing, decrease friction or trauma to the skin, and limit pain to the wound site.
No tapes or adhesives should be applied to EB skin. When removed, tapes and adhesives may tear off skin and result in severe blistering.
Infection is common in EB. Mild infections may require only the use of topical antibiotics or bleach baths. More severe infections may require the use of oral or IV antibiotics.
When EB is suspected, a skin biopsy can be done to confirm an EB diagnosis and identify the type of EB.
A wound occurs when there is a break or an opening in the skin or mucous membranes. Wound healing is a complex process that begins the moment an injury occurs and can last for weeks or even months.
Dressing changes can last for several painful hours each day.
Different wounds at different stages of healing require different wound care products. To optimize healing, each wound should be assessed during the dressing change to determine the right products to use.
A blister, erosion, or wound should be bandaged if the wound requires protection from further trauma or friction from clothing, if the wound is draining or bleeding, the wound requires a topical treatment for infection, the wound is painful, and a dressing will improve comfort.
Here are some key tips for dressing changes. Dressings must be non-adhesive. Moisture balance is essential for healing. Moisture may need to be added to help heal a wound. A wound can also be too moist. An absorbent dressing should be used to absorb the excessive drainage. An affected wound may benefit from a silver or another antimicrobial dressing. Personal preference matters a lot. If you do not find a particular dressing comfortable or effective, don't use it. Ask for an alternative.
The 2 most important techniques to remember during dressing changes in order to minimize infection and pain are
maintaining a clean, sterile environment, and avoiding tapes and adhesives.
Maintaining a cool environment is helpful because EB skin may be more fragile in hot and humid conditions. Lubricating the skin daily with a non-medicated ointment such as Vaseline or Aquaphor will reduce trauma to the skin by reducing friction.
To protect the skin from forming future blisters, a person with EB may find comfort by wearing soft clothing. Another tip is to wear clothing inside out so seams don't rub against the skin.
When blisters appear, the goals are to reduce pain and discomfort, prevent loss of bodily fluids, promote healing, and prevent infection.
A doctor may treat a blister by explaining how to safely break the blister and recommending special wound care dressings to help the blister heal and prevent infection.
Research is being performed by hospitals, universities, and manufacturers in hopes for finding more effective treatments for EB and hopefully a cure. Studies are related to gene therapy, bone marrow transplant, and wound care dressings that may help heal blisters faster.
Through the use of specialized dressings and wound care products, caregivers can help heal existing wounds and minimize complications, such as infection, pain, scarring, and contractures.
For more information about National Rehab wound care products and insurance coverage, call Bill Kornman at 1-877-567-8468, extension 5318. Email the NR EB Advocate team at ebadvocate@nationalrehab.com. Visit www.ebnurse.org or join the EB Advocate group on Facebook.